unfair and very tough act to follow after Dr. Nadkarni. So I'd keep it short and sweet. Uh, so I'm going to talk a little bit about the role of social media in healthcare. These are some of the statistics from India as of last year. So they're a bit old. There are about 112 million claimed internet users, which is still an underestimate. I think it's almost twice, the way it was being projected. And there are about 60,000 doctors each on LinkedIn and Facebook, which is about 20% of all registered doctors in India, and at least 15% of doctors use smartphones. So doctors are online. The question I was trying to answer was, can social media impact healthcare? As a family physician who chose to come back to India, there is quite a bit of unlearning I had to do. I was quite an arrogant doctor who took pride in making patients wait, and who dreamed of having a corridor full of patients when I went to US. And during the training, I was, I think, broken in a nice way and humbled down. And this importance of health literacy, patient education, and importance of good communication skills was drilled down. And it just became a habit, and I didn't realize it. I didn't realize how I had changed. So coming back to India, I would say I didn't get a very good reception from doctors around me. I was trying to mentor a few doctors, and it's a problem. Health literacy doesn't come naturally to doctors, because our medical education is, the curriculum is 50 years old. The doctors who trained back then are here no more. And the role models, like Dr. Malpani, Dr. Datar, are far and few. The doctors we trained with, there were few good role models, but there were few, who bragged about, having busy corridors, or, family medicine is sort of outdated, and for the, lack of good term, the losers who don't get through any other post-graduation specialties. So family medicine is not celebrated or glorified. So like Ms. Hema said, where are those general practitioners, when I was young, there was one doctor in town. I grew up in a small town. You could go with anything, whether my grandfather was having a heart attack or whether we needed vaccinations. There was one person you could go to and trust him with your life to do the best for you. And that is gone. So in my mind, for health literacy to work, it takes two to tango. We can empower patients all we want, but if they are sitting in front of doctors who are not sensitized to health literacy, who are not open to providing information to the doctors, because doctors are first responders. Patients still, when they are sick, they look up to doctors to do the best for them, provide the information, follow the best evidence-based guideline that's out there, do what's best for them. This problem could remain unsolved. There is a reason patients are looking at various internet sites. They're out there, and numbers show us. But there is a huge disconnect. Patients are dissatisfied, and so are doctors. Medical malpractice suits are going higher, which no surprise, as Dr. Datar said, because there is so much dissatisfaction. And I think to make a health literate ecosystem and health literate organizations, we have to sensitize, and we have to train doctors to be sensitive to those needs. The doctors who are practicing out there, a huge number of them don't think there is any value or ROI in having a health literate organization. So how do we change it? Like I said, there are lots of questions. I still don't have a good answer for them. But I am trying to solve it a bit, or it's a small endeavor to go towards sensitizing doctor, or at least finding like-minded doctors who could meet on a platform. Doctors work in silos. I think at times we are lonely. There is no support system. We associate a lot of shame with being wrong, or not knowing the right answer, or not having the huge patient following. And we don't talk about the daily struggles that we go through. What's it going to take for me to take the steps to make my patients health literate? Am I going to get anything back? Is it going to cost me seeing 5 less patients a day? Am I ready to do that? Or what support system is out there? Today I met with Dr. Datar, and I'm feeling, as and when I meet doctors like you, I need to know, how can I know more about people like you who are trying to do such fantastic job, in their community? Do I need to reinvent the wheel? Can I learn something from you and extrapolate, or can use that in my community in Bangalore? So it's in a very nascent stage. It's a community of health doctors. We are trying to bring the stories of doctors. We are trying to connect doctors. And Dr. Malpani is one of our featured bloggers, and we try to take some pieces from what he writes, and try to bring more stories every day. So that's what I'm doing. And that's all I'll say. Keep talking, keep learning. We as doctors, have to nudge each other or work with each other to educate our patients every day.